Hello there, my name is Glafkos Tombolis. I'm a dentist and I'm the owner of Ethicare Dental. I hope you're all doing well with your self-isolation. And I know that we're spending lots of time watching TV and online just to keep ourselves informed. I thought I would do my bit, and I'm producing a series of videos to help with that. This is the second of the videos that I'm doing, and this one is going to be discussing dental emergencies and various aspects of that and how we deal with those from home. So I guess the first thing to say is that there's quite a lot of information here to discuss. So I've got some notes in front of me here that I'm going to be reading from. I just want to make sure that I get everything right. And if there's a particular topic that you want discussed, my plan is to put what the topic's about on my right hand corner. So if you want to fast forward through any particular information, you'll be able to get to the part of the video that you're interested in. Okay, so the first thing to talk about are painkillers in dentistry. I'm not going to give any general dosage advice since the dosage is largely determined by the age of the patients, and there'll be too many figures to remember and to know. So, but just to let you know, there are two main painkillers in dentistry which tend to be used, and they are paracetamol and ibuprofen. The important thing to say is obviously if you have an allergy to either of those, you shouldn't be taking them, and obviously many of these painkillers, any medication, can have interaction with something else. So if you're taking other medication, you should be taking advice from your pharmacist or your doctor with regards whether you're able to take any of those two painkillers. The other thing to say is that there is some evidence that ibuprofen can make coronavirus worse. I think the jury's still out on that, but the advice from NHS England is that you should avoid it if you can. And so if you have toothache, then that's something that you should be avoiding if you have symptoms of COVID-19. So take paracetamol under those circumstances, unless you've been told that paracetamol is not suitable for you. You should take painkillers in accordance with the instructions on the packet. Taking too many tablets or taking medication incorrectly can cause stomach, liver injury, or worse. Okay, you don't want to do that. If you're taking any other medications or not sure what you can take, check with the pharmacist first. If you're taking something like codamol that should be taken on its own, don't take with paracetamol or ibuprofen. Codamol contains paracetamol. If you're then taking paracetamol as well, you're going to be overdosing on that medication. The other thing to say is that if you can take paracetamol and ibuprofen, they can be alternated for maximum effectiveness. The second topic that I wanted to talk about was what happens if you're suffering from toothache. Well, we've spoken about painkillers, so they are going to be useful in helping you to deal with that toothache. Good oral hygiene, making sure that your teeth are clean, keeping the area which is causing the toothache free of bacteria is going to be helpful. Making sure that you're cleaning with a fluoride toothpaste. Fluoride acts as a desensitizer. Also reducing sugary intake of food. If you reduce the sugar levels, sugar can cause sensitivity in teeth, and that can help to reduce sensitivity. And obviously if you're reducing the bacteria in the sugar level, that will ensure that the decay won't get any worse, which if we're going to be in lockdown for any period of time is going to be to your advantage when eventually you can get the tooth treated. If there's a hole or a broken tooth, there are emergency dental kits that you can buy from pharmacies, and can be brought to patch up the tooth at home. The kinds of products are with temporary filling materials, and there are various brands. There's one called Refill It, there's one called Toothfill, there's one called Dentec Tempara, and there's one called Dentemp. These are widely available from supermarkets and chemists. They can be effective if you have a sharp tooth or you can see a hole in the tooth. So if you're using a temporary filling material to fill a hole to cover up a tooth, that's going to protect the tooth. So if you have anything hot or cold, it won't be able to get to the area of sensitivity. If there's a sharp area and you apply a temporary filling material, it will help reduce the sharpness of the tooth, so that can help alleviate the discomfort that you might be experiencing. We've already spoken about good oral hygiene, but using a desensitizing toothpaste is also is going to be of value. So a toothpaste like Sensodyne Repair and Protect, if there's exposed tooth structure, that can often cause temperature sensitivity. That exposed tooth structure can be for a variety of different reasons. It could be that the gum has receded slightly, it could be that there's a hole in the tooth, it could be that you've got some decay in the area. Then applying that Sensodyne Repair and Protect can help alleviate your symptoms. Yes, if the nerve within the tooth is really flaring up, then it's not going to make too much difference. And under those circumstances, you should be certainly giving us a call or emailing us. But if you're getting a little bit of sensitivity, then the Sensodyne Repair and Protect might make a bit of a difference there. There is a product called Oragel Dental Gel. It's not supposed to be used for children below the age of 12, but again, that has got a local anaesthetic inside it, and that can help to reduce any sensitivity sometimes from teeth. The important thing to say is that if you're in any doubt about the toothache that you're experiencing, then there's lots of different advice that I've given here, which I think would be of value. But if you're in any doubt, then give us a call or email the practice. If you call us on 0208 870 5059, you'll be directed to the emergency mobile number. The email is smile@ethicaredental.co.uk. The next topic that we're talking about is bleeding and pain after a tooth is removed, after an extraction. So the first thing that's going to stop any bleeding is pressure. And if you can bite down on, it's quite likely that if you've had a tooth removed recently that you would have been given some gauze packs by the dentist carrying out the extraction. So bite down on those or a handkerchief for 30 minutes, okay? And that should help to stop any bleeding. Do not spit or rinse if the tooth was extracted in the last 24 hours. Spitting or rinsing can break the clot which is forming, and that can cause it to bleed. If you've got a bit of saliva which has got a slightly pink colour, or there's a bit of oozing from the area that the tooth was removed, that's perfectly normal. And if the bleeding hasn't stopped, then just call the dentist that removed the tooth, or you can call us or email us. Once again, our email address is smile@ethicaredental.co.uk. Our number is 0208 870 5059. You'll be directed to the emergency contact mobile. For the pain that you would be experiencing after a tooth is removed, the regular painkillers, Nurofen, paracetamol, as long as you're not allergic, as long as there's no medication that might combine with that, you should contact your doctor or your pharmacist if you're in any doubt about that. Aspirin can make bleeding worse, so avoid aspirin. So the other thing that can help with the pain is rinsing gently with salt water after meals, as long as it's been 24 hours after the extraction. Okay, you shouldn't be rinsing or spitting before that, because that can make the bleeding worse. But if the bleeding has stopped, using a saltwater mouth rinse, keeping the area clean, can help alleviate sometimes the pain. So the other things that can make the pain from removing a tooth worse is smoking, so avoid smoking. We tend to say for 24 hours afterwards, but if you can kind of reduce the smoking you're doing for as long as possible. Or rinsing, because if you rinse, not only will it bleed, if you break the clot, if you smoke, you're more likely to suffer a dry socket, and this can be really uncomfortable, really painful. So what you need to do is avoid smoking for as long as possible after the tooth has been removed, and rinsing, as I say, will break the clot down and can lead to this particular condition, which is relatively unusual, relatively rare, but nevertheless it can be very uncomfortable. Important thing is then maintain good oral hygiene, avoid smoking. Antibiotics will only help in very specific circumstances, and if you have any concerns or any doubts, just call the practice 0208 870 5059 or email smile@ethicaredental.co.uk, and we'll be able to give you some advice in terms of how we deal with the situation. The next topic that I want to talk about are the pain caused by ulcers. Ulcers can be caused by many different things, but often by dentures rubbing or a broken orthodontic wire. There's lots of different reasons. So the kind of things that you can use to help alleviate the problem and the pain caused by ulcers are products such as Bonjela, especially before meals, can be good. Good oral hygiene is always going to be good, just to make sure that there's no infection which develops. Regular painkillers, again, you need to make sure that you check with your pharmacist, your doctor, if you're in any doubt. And again, they're usually Nurofen or paracetamol. Rinse with warm salty water, that can often alleviate symptoms. There are other products around that you can get from pharmacists. There's a product called Difflam mouth rinse or a spray which you can get from your pharmacist. Soft diet, anything, you don't want anything too hard rubbing against the ulcer. If you've got a denture which is rubbing against the ulcer or causing the ulceration, you can use a nail file or emery board to soften the edge of the denture, and that will help reduce the discomfort of the denture rubbing against. If there's an orthodontic wire which is broken, you can often bend in the wire so that it's not rubbing against the cheek or the area, or you can use orthodontic wax if you've got some, just to cover up the broken bit of wire. The other thing that you can do is leave dentures out if they're too sore to wear. You can consider using fixative for loose dentures, a product like Fixodent, so that if they're not moving around as much, they're less likely to cause ulceration. Or C-bond denture pads also may make a denture more comfortable or more stable. So the next topic that I'd like to talk about is what happens if you lose a crown. So the thing to do is take the crown if it's come out, clean and check it. If it's hollow, you might be able to attempt to re-cement it. You need to remove any debris with something like the tip of a paper clip and just scour the old cement away. Check that the crown fits without the cement and check that the bite feels correct. You should never force a crown or post onto or into the tooth, as this can cause the root to fracture. Probably the most important thing to say is do not use a product like super glue, okay, ever to try and re-cement a crown. You will end up doing more harm than good. Or a product like Fixodent to fit a crown. Never use super glue. There are lots of products around that you'll be able to get from your pharmacist. There's a product called Recap It, which is available. So what you need to do is dry the tooth and the cap, the crown, mix the cement as instructed on the packet, and fill the crown. Place the crown directly onto the tooth, bite firmly to press the crown into place. Remove any cement carefully with a toothpick and floss between the teeth. The last topic that I'd like to talk about is the pain and discomfort which can be caused by your wisdom teeth. Often the wisdom teeth can cause pain and problems for many reasons, but the most common cause for discomfort is the fact that there is inflammation of the gum over the tooth, the wisdom tooth, which is coming through, and that can be worsened, for instance, if you bite together, because of the skin above the tooth which is coming through becomes inflamed. If you then bite down onto it, that can make the discomfort even worse. So what can you be doing to reduce the pain, reduce the symptoms? Well, good cleaning is always of value. Keeping the food debris and the bacteria down in the area is going to keep the area cleaner, and there'll be less chance of infection as a result. So good cleaning. Corsadil mouth rinse. So Corsadil mouth rinse, good for keeping the area disinfected. Again, that's the gold standard mouth rinse, as long as you're not allergic, to help reduce any symptoms, and also potentially Corsadil gel. You can get both those products from pharmacists as well. Soft diet, again, so that you don't have anything too hard pressing against the skin. That's going to help settle things down a little bit. Painkillers, again, I've said this many times during the video, but check with your pharmacist. Make sure that it doesn't interfere with any of the medication that you're taking. Warm, salty mouth rinse can help as well. And the important thing to say with problems with the wisdom teeth is, again, if there's difficulty swallowing, if there's swelling in the face or the cheek, or difficulty opening the mouth, call us immediately on 0208 870 5059 or email us at smile@ethicaredental.co.uk. Well, I hope that some of the topics that I've discussed addresses some of the concerns, many of the concerns that you might have. It's not an exhaustive list. There are other things, I'm sure. What you can probably see is I haven't gone into details about discussing antibiotics. The important thing to say is if you're in doubt about any aspect of this, either email us on smile@ethicaredental.co.uk or call the practice. You'll be directed to the emergency mobile number. And if it is appropriate to prescribe you antibiotics, we'll be able to, after taking updating or taking a medical history, to prescribe you the appropriate antibiotics for any condition that you might have. We'll obviously be discussing the other aspects that I've already talked about during this video in terms of pain relief and so on. Or, if appropriate, we'll look at potentially referring you on to one of the acute emergency care dental emergency care centres, which have now been opened up in London and are now up and running. So thank you very much for your time. Thank you very much for listening. I hope this has been of value. There'll be various videos being released, as I say, over the next week or two. Thank you very much.